Hi all, this is Julie, your instructor. I wanted to give you a heads up about what's coming up in the next couple weeks. One of the things we need to talk about is the soap notes. Some of you have done the HEENT soap note, and it was about 50-50. You're still not grasping the concept of subjective versus objective. Subjective is what the patient tells you, like their symptoms. I have a runny nose, I have a headache, I have a sore throat, my ears are plugged. Objective is when you do your exam and this is what you see. You see bulging tympanic membranes, you see swollen tonsils, you see cobblestoning on the tongue and the tonsils. You hear raspiness or wheezing in the lungs. You're listening to cardiac, you're hearing a rub or a thrill. Those are objective issues. You need to understand the difference between the two. The soap note, remember, is a great communication tool that we use from provider to provider. And you don't want to look like a big dummy on there. So you need to really work on getting those straight. Another thing that I wanted to cover is this week you're going to be starting your clinicals. Remember that your clinicals, you should consider those like a business opportunity. You need to be on time, you need to be ready, you need to be professionally dressed, either in scrubs or business casual, whatever your preceptor has told you to wear. You're probably going to be on your feet a lot, so make sure that you have comfortable, clean shoes on. I don't want you sitting around looking at your phone, shopping for things on the internet. This time you need to make useful use of. You are working under someone else's license. You remember what that was like when you were an RN. This time you're working on, these preceptors give a lot of their time and energy for you to train you, and you need to be respectful of that. Make use of your time. Bring your study materials if you're not going to be busy. Ask your preceptors meaningful questions. Write down your questions if you have questions for them. If they give you an assignment, you better have it the next time you show up at clinicals, okay? Some other things that we need to cover is I've had questions about how many patients do I record every day. You need to account for each hour you're there. So let's say that you're doing clinicals for 8 hours. You need to account for seeing one patient an hour at least. You may be seeing 16 to 20 patients a day. My suggestion would be, so you're not clogged up working on typhon so much, is you pick 8 of those patients and you account for each hour that you're there. So what you need to write down in typhon is you need to have their demographics. So we're accounting for 1 patient for each hour that we're there. If you work a 12-hour shift, you'd have 12 patients. If you work an 8, you're working with 8 patients. One of those patients out of those 8 or 12s that you're doing, you need to pick and do a soap note on. And so when you do these soap notes, it's not a focus soap note. We're doing a head-to-toe exam. I want to know each system in that soap note ought to be filled out. So you're going to take the time to go in there and ask the patient several questions. My suggestion would be what I did when I was in clinical, and I went to an online course as well. I had a template that I used, and I just kind of went through and had everything written down, and I circled whatever the patient told me. That way I wasn't clogging up a lot of time. It made it a lot easier for me to get through and make sense with, and I think it might work for you. So just to iterate that, we're gonna say, let's say that we see 8 patients in a day of clinical. We're gonna do 8 patients in typhon to account for our time. One of those 8 patients we're going to pick and do a soap note on. That's if we did 8 hours. So like I said, I want it to be a head to toe. If it's a focused exam, you're gonna get dinged on it. All these 5 notes that you have to do during your clinical should be head to toe. And keep this in mind, no one starts out doing excellent soap notes. It's a learning process. It's something that you're gonna have to work on and you get better at as you go. But my job is to get you ready for the next class that you're having, and it's kind of like building blocks. So we're working on the base right now, You need to learn how to do that proper assessment and get that SOAP note done. I've told your preceptors that you're not ready for clinical guidelines. You don't understand yet at this point you don't know what meds to give the patients. Right now we're focusing on just assessments, and they all should understand that very well. If you're having problems, let me know, and I will contact them and talk about it. One other thing that I want to reiterate is that you make sure that I have the email you sent me on the Google sheet is the right email that your preceptor has, because everything goes into typhon, and that's how I contact them. It's going to be a real mess at the end of the semester if I don't have that right email. So just make sure that you're staying in contact with them and that we have the correct email. I think that's about all I have for now, and I wish you guys good luck. I hope you make the best of your time, and you probably will enjoy it. You've been looking forward to this point, okay? Bye, guys.